Good afternoon, everyone. Thank you for joining us. My name is Kirsten Houghton. I'm a principal at SVA and part of our nonprofit service group line. Thank you again for joining us virtually. Hopefully one day we'll see you soon back at the Madison Club. In my work with nonprofit organizations, which I've been doing for over 20 years in Madison, the surrounding area, I've done a lot of consulting, audit, and tax services. History of our event, or these events, goes back to 2005 when we first started SVA's nonprofit roundtables. At that time, we moved to the Madison Club in 2012. And in 2020, obviously, we went virtual. We also acquired a new co-sponsor, which is QTI, which has continued into 2021. So with that, I'll first introduce Todd Starkey, who's HR Strategic Advisor at QTI and a co-sponsor today. And Todd, would you like to jump in and say a few words?
Thank you, Kirsten. As you mentioned, my name is Todd Starkey on the QTI HR services side, and we are just so grateful for everyone being here today. This is a really extremely important topic that just continues to show up all over in the news and within our own families. QTI has been able to assist organizations all over Wisconsin, particularly on the mental well-being side. Different subjects will come up. Remote work versus in office, vaccine versus unvaccine. How does it work in the handbook, and how does it affect compensation, and how do we, help employees while being productive at the same time? So we're just really grateful for everyone being here today. Glad QTI has been able to partner with so many great organizations around Wisconsin and outside, and grateful that Quartz is here today. So thanks for attending, and we hope you get a lot out of it.
All right, thanks, Todd. So today, as Todd mentioned, we'll talk about mental well-being in the workplace. Our speaker will touch on supporting your workforce's mental health and providing resources to help the employees thrive, and also yourself, of course. And we'll talk about the impact of COVID-19 on mental health and the related stress that's happened and continues to happen as we're still in the pandemic, and we've got many other issues to deal with as far as Todd mentioned, vaccinated versus unvaccinated, being in the office, not being in the office, many things to touch on. So I'll mention with this virtual format, we are opening up the chat feature so you can put your questions there. Also, you'll be able to see each other's questions, and so you'll know kind of what's going on, what's happening. And Kim, our speaker, will then be checking that as well. So hopefully incorporating your comments and questions into her presentation as she goes. And we will have time at the end for Q&A as well. Later today, too, you will see receive a survey via email. And we have a number of questions in there, but we want to make sure that what we're providing to you is important content that you're getting value out of. So with that, please complete that survey. And then also we ask if you've got ideas for topics and speakers, as we are always looking for relevant topics with really good speakers that will appeal to you as the audience, that will give you value again. So our next event will be held on Thursday, December 16th. Right now, we do have a room reserved at the Madison Club, but we'll see if that can actually happen. If not, we will go virtual. So we're working on that. And then also a topic and speaker as well. So again, why that survey is so important. We appreciate your help. So at this time, I'd like to introduce Kimberly Hein-Beardsley. Kim is the Quality Management and Population Health Specialist at Quartz Health Solutions. With Quartz, Kim delivers health coaching and workplace wellness, focusing on emotional wellness and behavioral health. Kim is a licensed marriage and family therapist, a board certified coach, and a certified health coach. And with that, thank you so much, Kim, for joining us today, and I'll turn it over to you.
Sounds great. Thank you very much. And thank you to everyone who is tuning in for this presentation today, or those of you who are going to be watching the recorded version at a later time. This is such an important topic, and one that I feel we all can relate to. And we all may be at different places in the workplace, different stages as far as where we're at with whether some places are still completely remote, some folks have gone completely back into being in the office, others are in a hybrid work situation. There may still be questions outstanding as far as what is our new normal going to be? Are we going to continue to have a hybrid, or what is that going to look like? So there's still a lot of uncertainty going on just within the workplace, and as has already been mentioned, there's still a lot of uncertainty going on related to the pandemic as well. This has been a long experience for folks, and and not unusual for some of our emotions and our reactions to kind of ebb and flow. For a while, we might feel like, okay, I got this, I'm doing okay. And then other times, things may feel that much more challenging and that much more stressful. A few months ago, it kind of felt like there was a light at the end of the tunnel, and now we're kind of back in the thick of things with a lot of unknowns and really directions that we're being given changing on a daily basis. And we all know that there have been those differing stories or opinions out there, and that can be very stressful. And the toll that this is taking on individuals, employees, employers, this has just been a long haul. And really just, being able to kind of honor where we're at and be okay with acknowledging that and be okay with what we're feeling. And so my hope today is I'm going to kind of go over the impact that COVID's been having. I'll share a few statistics with you, but then I'll also talk about, what can you do as organizations, as individuals to kind of help navigate through this, help your staff navigate through this, some tools that leaders can be able to utilize, tips that we can all use for managing stress and being resilient through this continuing time of change. Talk about, if we are concerned about somebody else, how do we approach them? How do we try to offer our support or share some resources, and making sure that we really feel comfortable with what are those resources that are available out there. So my hope for today is that you will leave this time feeling like, okay, I feel like I know where I can go to get some more information if I'm needing it. I know I have some things that I can do to make sure that I'm supporting my employees. I'm taking care of myself as well. So I'm going to go through the slides, and then I'm also going to go out and pull up some handout documents that I want to be able to showcase for you to be able to let you know those resources available, and then also take a look at some websites as well. And I do reference a couple of these website links in the presentation. After the presentation is done, my understanding is that you will receive the slides and all of these handouts and resources. So this will be at your fingertips anytime. If you want to go back, or if you want to take a deeper dive into some of these handouts or resources, websites, to just kind of feel like, okay, I'm much more savvy or really knowledgeable about where I can go and some steps that I can take. I really want you to feel like you've got some of that at your fingertips after today. As mentioned, I'm going to keep my chat window open, so if questions come through while I'm talking, I will do my best to try to address that if it's related to kind of where I'm at that point. Otherwise, definitely I'm going to leave plenty of time at the end to be able to address additional questions as well. And I will probably open it up to encouraging individuals to share via the chat, what your experience has been, maybe what has been working well, or what have you already implemented in your workplace, because I believe in the collective knowledge and wisdom of the individuals on this session, and that we have a lot to learn from each other. And some things have been trial and error. And so being able to share that as well, I want to make sure that people feel like they can chime in via chat and say, hey, this is what we're doing and it's gone really well, or this is an area that I'm really struggling in, would love to have some other thoughts or resources or ideas. So I want this to be able to be, interactive that way via the chat. So I'm going to dive right in here. And like I said, I'll try to keep an eye on the chat as well as we go through. It has been said that people have accessed mental health services during this pandemic 3 to 4 times more than in previous years. Mental health is a big deal. It has been a big deal, but I do think this pandemic is kind of has like vaulted it into the forefront of folks' minds. And because it's been such unprecedented times for many of us. For many of us, we've never had to go through something like this before. Especially, early on, and it's still continuing, but the unknown, the level of uncertainty. I mean, I remember way back early on during early, kind of shutdown of things, like at the end of March of 2020, people didn't even know, is it safe for me to even be outside in my own yard? And a lot of unknowns still at that point with the virus, and what can we do safely? What's the best, method and things like that. So but it's a lot of continuing uncertainty. Not only, are folks concerned about their health and well-being, the health and well-being of their own families, but it's also had the impact on, what does my job look like? And we know many people lost their jobs during that time, and many have been able to get back into the workforce, but many are also still feeling that impact. And, worrying about others, worrying about what their job is going to look like, safety issues, and all of the kind of conflicting messages that you receive out there as far as folks' differing opinions on how things are being handled, just a lot of uncertainty and unknown that we've never had before, not to mention the isolation. We are social creatures. And so it was very hard for such a long time for folks to feel like they couldn't reach out, they couldn't do the things that they wanted to do. And I feel like more folks are learning their own comfort level at this point with what they do want to do as far as socializing. But definitely, I think this slide really showcases how, significant of a toll this has taken on individuals' mental and emotional well-being. Just a huge jump. And it's not just the adults. They've also said young people, youth, kids have seen a 3 to 4 times greater increase in people reaching out. I mean, I've definitely known that within my own circles as well. I have an 11-year-old who had become very anxious, suddenly having some anxiety attacks during this time, terrified of something happening to his grandmother, especially early on before vaccines. He's very aware of the fact that he's the one in the house who doesn't have a vaccine right now. And so having to see some of those things in people that we care about has been really challenging, especially when we don't necessarily have an end in sight kind of answer yet. And so being able to be, as I said before, be compassionate with ourselves, kind of honor where we're at, and recognize, what, my day-to-day coping through this is going to kind of ebb and flow, and that's okay. But the main thing here is that hopefully you'll be able to be left, leaving today feeling like, but I know what I can do, or I know where I can go to get more information. I know what steps that I can take. But especially as far as things that you might see in the workplace as well. Many of you are probably seeing this in your, feeling this in your personal life and in the workplace. Just, the impact of this chronic stress. It's not the same as when you're kind of pushing through a busy season just to kind of get through that project. This has been a year and a half of, oh my gosh, unprecedented times. And so many people I know, they talk about the term pandemic fatigue. Many people are like, I'm done. I'm just done. And sometimes it can almost get to the point where it's almost like a denial of even like there's even an issue, because I'm so burnt out. I'm so tapped out. I can't keep feeling this way anymore. So I almost have to act like it's not an issue anymore. So you may notice these feelings at times in yourself and in others, feeling that irritability, that agitation, the anxiety, the nervousness, just being burnt out, not motivated, not feeling productive, not feeling like, okay, I've got something I can feel excited about. Many people complain about having more challenges with sleep, whether they are having a hard time falling asleep or they fall asleep, but then they wake up and their mind is just racing with things and it's hard to fall back asleep, or there's just so much going on, so much uncertainty, bombarded with so many different messages that we can almost be paralyzed and overwhelmed to the point that it's like, I'm in a fog. I can't even make a decision. I don't know where to even start with things because I'm just feeling so overwhelmed. And recognizing this may not be a constant state, but it may bubble up at different times, kind of depending on where things are at. I remember, especially early on, feeling like, okay, there are days that things could feel like, okay, I'm doing my routine, I'm doing my normal things, this feels kind of normal. And then the reality of things would hit, and it's like, oh my gosh, now I'm feeling all of that uncertainty. I can feel good for a while and then feel all of that uncertainty again. And many of us are still kind of feeling like we're back in some of that degree of stress. And not to mention, we've had to learn a new way of doing things at work. For many folks, and not knowing what everybody's situation is, but I know for a lot of organizations, it was very quickly, okay, everybody's going remote. And what is that going to look like? And the uncertainty of, how do I do my job remotely if my job wasn't intended to be that way? Do I even have access to tools to be able to do what I need to do? Do I have the knowledge of how to use these new softwares and virtual platforms? And is my workload different because what I normally did in person, maybe now I'm not able to do anymore, and maybe it's not something I can do virtually. So was I suddenly left with a lot of uncertainty around what is my focus? How am I going to be able to still continue to do what needs to be done? Many people too are having concerns as they move back into the workplace, just around how safe do I feel in that environment? Maybe they're having to be back in just to be able to do what they need to do, but they may be concerned about risks of exposure, or now there's a new way of doing things at work. It doesn't feel the same anymore, or there's not as many people there. So the kind of the shot in the arm that we used to get from being able to interact with others, now we're more spread out, and maybe we don't feel like we've got the same interaction. So there can be a lot of feelings that kind of go in to being back in the workforce. And obviously I recognize that for some groups, some people, depending on where they were working and what they were doing, they may have been, at work, face to face the whole time, and having to try to learn new ways of doing things, or have these different protocols put in place to be safe, having to be with each other. Others went remote. Others had, part-time people went remote, and other folks stayed in the office. Some folks are back in the office. Some folks are remaining virtual. And so I realize that you all may be in different stages with where these things are impacting you. So some of these things you may have already gone through. You may have already experienced some of this. And for others, it may still be, you might still be kind of in the thick of things. But it definitely is something to be very aware of, and I'm sure you have been, as far as just all the concerns that the decisions leaders have been having to make throughout this time, as far as what kind of policies are we going to have around this? How are we going to make sure people are going to be safe? How do we get the business needs done? So lots of decisions leaders have had to make, but then also at the individual level, and the leaders individually can feel this as well, as far as, how do I still get all of this done in this new normal, in this new environment, and still balance that, or recognize that it's compounded by, some of the uncertainty, the anxiety, the worries, the concerns about our health and well-being at the same time. And so it's a lot to navigate, and recognizing that this has been a very challenging time, and it continues to be as well. Now, when I get through with the slides and go over some resources, I will bring up a couple of these web pages that I have the links here right now. Excellent resources that DHS has out there. And so I will be bringing those up for you. I'm just going to take a quick sip here. But some other things that I really encourage folks to think about, leaders and also individual contributors, is, being open and talking about, how you are feeling, what your stress is like. And also along with that, though, trying to make peace with what we can and can't control, because there are a lot of unknowns out there, a lot of things we can't control just yet. But it's like, okay, but what do I have control over? Because our minds can just spin when we're trying to, solve for, or think about, or ruminate on all these things, these unknowns, these things we don't have control over. But it's like, all right, if I can I got to tune some of that out a little bit, and I just want to focus on what I can control. What can I make a difference with? What resources do I have? How can I create or get back into a good routine? And for many people, they got into a certain routine when they maybe suddenly had to go remote, and then it's like having to get back into a different routine again, now that maybe they're going back into the office, or they're in the office a couple days a week. And that can be challenging as well, and figuring out, okay, what is that new, what is that new routine going to look like? How do I navigate this? Because I also know a lot of people found that there were things that they really enjoyed doing when they had more time at home. And now people are trying to figure out, how can I still balance that when I'm back in the office? How can I still make time for things? Having some time at home and having time when things potentially slowed down early on in the pandemic did give people a chance to kind of reevaluate their priorities a little bit, and determine, okay, what is really important to me? And now people are trying to figure out, how do I, maintain that sense of my priorities, and how do I fit that back into getting back into a certain routine at work, and or creating a new routine at work? How do I do that? But I know many people can be very sensitive to all the information that is out there. And so sometimes we have to kind of put up a little buffer around that, because being bombarded with people arguing on social media or in the news media, or the scary stories or the conflicting stories, or things changing on a day-to-day basis, it can be overwhelming, it can be exhausting, and sometimes taking a bit of a hiatus from that can be very helpful. It doesn't mean we're turning a blind eye. It doesn't mean we're burying our heads in the sand or we're trying to ignore anything, but we're recognizing, okay, can I do anything about some of that directly or not? And if I can't, can I just give myself permission to say, I just need a little bit of space. I am very aware of the reality of what's going on, but I need to focus on recharging my own batteries. We've been living in this state of anxiety and uncertainty for so long that being able to, balance that with what we need for our own self-care is so important. And giving giving your employees that space to be able to kind of talk about or have those conversations with their leaders as far as, what do you need right now? What will help you feel like you can be successful in your position right now? What support can I offer for you? Finding out, encouraging people to, make sure that they, in addition to their other duties at work, make sure that they're building in that time and they're giving themselves that permission to still do some of those self-care things that are so important. Whether it's like, I need to connect with others, or I need to continue to make sure that I am, having family time, or I'm exercising, or I'm doing meditation, or whatever it might be that people are finding works for them to manage this stress and manage this time, making sure that people feel like they can still do those things to take care of themselves, and feeling, having those supportive conversations with, with staff can be huge for staff to feel like, okay, my employer cares about me. They care about my overall well-being. And that's where knowing some of these resources, if you can see that somebody's in distress or just struggling a little bit, kind of knowing what you can offer, knowing the supports that are available, and having some idea of kind of how to approach that conversation. And so this particular slide, and I have a handout that does summarize some of these steps here. So I want to make sure that you feel like you have this to refer back to, but these are some steps that Medi Spies' group, A World Without Suicide, put out to be able to how to approach that conversation, to be able to offer some support. And the first step is simply acknowledging, hey, I noticed that you haven't been yourself lately. Are you doing okay? Maybe you're noticing that somebody's not turning on their camera as much if it's a virtual environment, or they're not engaging in the kind of socializing little chit chat that might happen at the beginning of a meeting, or the tone of their emails is getting a little different. And you're just like, okay, that's not their normal behavior. I want to check in with them. Just being able to say, hey, I noticed you haven't been yourself lately. Are you doing okay? And they may or may not choose to share some things with you, but if they do, just be like, you know what, thanks so much for telling me. I'm so sorry that you're having to go through such a tough time right now, but how can I help support you at this time? And Medi with A World Without Suicide, they did some research and found that using the word support as opposed to just help it was received better. How can I help support you, just as opposed to how can I help you? Some people kind of got a little defensive with just how can I help you, but feeling like, hey, I'm just offering support. I'm not assuming you're not capable, but I just want to know how can I support you? And then have some ideas of things to be able to suggest for them. Are you open to talking with your doctor or nurse? Are you interested? Are you wanting to kind of see, a therapist or a counselor, knowing for sure, finding out first if your health plan offers, behavioral health services as a benefit? Do you have an employee assistant program? Do you have an EAP program that you could encourage them to take advantage of, or just provide the resource for them? Say, hey, there's no cost for EAP. It is confidential. I just want you to be aware of the resources that are out there. Even if they're, they don't have to agree to this, it's simply you noticing, you inquiring how they're doing, and just say, even if they don't want to share very much, to say, hey, if you ever feel like, I just wanted to check in because I felt like, you weren't really, acting like your normal self. And I just kind of wanted to see how you're doing. Just want you to know, if it ever feels like there's a time and a place that you are looking for additional support, here's our phone number for our EAP program, or have a resource like that to be able to share with them. Just knowing that you noticed and that you checked in with them can be huge. That really can make such a huge difference to feel like, okay, my manager, my supervisor, my leader, my coworker picked up on that, and they cared enough just to check in with me. Maybe I was just having a bad day, an off day. Maybe I didn't sleep well, or maybe it is. Maybe I really am struggling more, and I could benefit from kind of knowing at least what the options are available out there. So some of the things to be thinking about then are, kind of researching or knowing for sure with the contact information. If you do have an EAP program, how would folks get in touch with that? So kind of having that readily at your fingertips, but also referring people to their primary care providers, behavioral health providers. There's also, if things seem more dire or more distressing, the National Suicide Prevention Lifeline, and there's also a text line as well. I often encourage people to program those two, the lifeline and the text line, into their phones, just so they have it. Hopefully you don't have to use those numbers, but just having them at your fingertips can be extremely helpful. So you're not scrambling if somebody really is disclosing that they are struggling. I am going to jump out to some of the resources here quick. I'm going to exit out of the slides, and I want to be able to share with you some of the other things that I have. And as I mentioned, these handouts and things will be available to you, so you'll have them to go back, do a deeper dive, study up on them or read them a little bit more. But I'm going to kind of page through them a little bit to orient you to what's out here, because there's some really great stuff in these resources, and I want you to be able to have that available. So this is a handout that was put together by A World Without Suicide, and this really is intended for somebody who may be just struggling a little bit with like anxiety or depression, or they might be really having a more difficult time where they might be struggling a bit more with some thoughts of self-harm or things like that. They tried to make one handout where the questions and the things to pay attention to could apply to either, so you have one handy reference, but it's some things to kind of pay attention to. What might you be noticing in an individual that could give you a heads up? Hey, I'm kind of concerned about how this person's doing. And even if you notice these things in yourself, if you notice, oh, wow, I'm really feeling just more on edge, or everything is nails on a chalkboard, or I'm just angry all the time and I can't sleep. Even just knowing some of these things can be signs for ourselves to say, maybe I do want to reach out and just, call my doctor and just touch base a little bit, just to say, hey, I've been feeling some of this, just kind of knowing what those resources are available. So being familiar with, kind of familiarizing yourself with some of the warning signs, behavioral things that they might be doing, certain situations. Sometimes if folks have gone through a crisis, obviously a pandemic or a loss of somebody during the pandemic could be a part of that as well. Or if they have lost a position or had a significant job change, that also could lead to, more things to be concerned about, and then paying attention to things that they might be saying. But here on the left-hand side is where she kind of summarizes the same questions, how to approach that conversation with somebody, how to say, I notice you haven't been yourself lately, how can I best support you? Here, are you open to reaching out to, for some assistance? Here are some numbers I want you to know. And some great information on things to be mindful of for do's and don'ts as far as, how to be really approach it in an open way and not a judgmental way. Let them know that you're there for them and that you're being supportive of them. Don't try to minimize, don't try to brush it off like it's not a big deal, because we really don't know. We're not in that other person's shoes. So it's not up to us to kind of make it say like, oh, you're just overreacting to this. We want to be there and we want to be able to be open or be able to listen to them without judgment and offer them some resources. And so she's got some great, the phone numbers and the text line and things like that on here as well. Center for Workplace Mental Health also has a nice handout. It's called Notice, Talk, Act, where it's very similar content. So you'll see that some of this does kind of overlap. But again, I'd rather you have more resources to look at than feel like you don't have enough information. And so again, it really kind of talks about why is it important that we are supporting people? Or why is it a big deal that we're supporting our employees? Well, if they feel supported, they are going to feel recognized and appreciated and valued by their employer. They're gonna be like, you know what? They really care about me. They are invested in me as a person. And so they're gonna be more loyal. They're gonna want to be more productive. They're gonna wanna stay at a place that really shows, you know what? We value you. You are not just a number to us. You are not just about the bottom line. We care about you as an individual. And that can go a long ways. And so having some of these, resources and information available really can let them know, you know what, they do care about us. And so again, this handout kind of says, goes over what are some of the behavior or mood changes or things like that to notice. And then how do you have that conversation, do's and don'ts for things you might want to say. And then also, what can I do? How can I take action? What are the resources or things that I can refer this person to? Now, Wisconsin DHS put out two excellent handouts that I want to share. One is specifically for employers, and one is for the employees. And this first one here that I'm bringing up has some great things as far as what you can do to support, have that open and supportive environment. What are the signs? Again, you'll see the theme. They're really trying to reinforce what are the things to look for and pay attention to. How can you have that, a good conversation with them? How do you know, make sure that you've got at your fingertips the resources that you want to be able to refer them to. And then a similar document here for the employee, for them to be able to help, be able to get some resources and help themselves. Also are things, hey, what are they noticing in themselves? My own mood changes. What are some, can I go out to Resilient Wisconsin, which I will pull up on the web, and find out more information and more tools to help me cope? What are other, hotlines and things like that I have that can help me be able to, cope through this and other difficult, challenging times. And the last document that I want to share here, there are some more that I have available, but I want to see if I can bring this one up real quick. Is another one from the Center for Workplace Mental Health. And it really kind of walks employers through how to support employees through this time of transition. It's about 5 pages long, so I won't go through a lot of it, but it's an excellent one, again, as far as being mindful of what their concerns may be, open and transparent communication. I will say that was one of the most beneficial things that my employer did from the get-go. Very early on in the pandemic, leadership started sending out weekly emails with very transparent information as far as this is what's going on. This is the latest that we're hearing on the pandemic and what we, steps that we can take. This is what's happening to make sure, now that we're remote, people have the equipment that they need. And it was always including, here's information to help support your mental well-being. And that was huge. And they continue to send out these emails. So we're always feeling like we're in the loop, that we know what's going on. They're constantly letting us know, okay, this is going to be the plan for returning to work, or this is what needs to be in place for us to feel comfortable comfortable returning people back to work. And so being able to communicate often and be transparent is such a big deal. But again, recognizing some of those signs that folks might be struggling with. And, just knowing that people may feel, very uncertain and that we still don't know what our new normal is going to look like. We may not have settled into what our long-term way of operating is going to be because we're still in the pandemic. And so, being able to give them some of those resources. And then I just want to be able to let you know about a couple of the websites that we have here as well. This is Resilient Wisconsin, and they've got a lot of great information out here, taking a closer look at resilience, helplines, hotlines, virtual support meetings. They have some pages specifically for COVID-19 for business employers and workers. Lots of resources and information down here as well. Oops, I want to be able to pull up the whole thing here. And there's another Resilient Wisconsin page in here where it really talks about coping, recognizing the signs of stress and that stress can take many forms. Down here under Caring for Yourself, they've got a list of different apps that you can utilize. They also have this COVID Guide and Wellbeing Toolkit for resources as well. And this is by Center for Healthy Minds, and they share a lot of information out here about guided meditations. They also have an app called Healthy Minds that right now is available for free for individuals to take advantage of. And so I really encourage you to check out these pages from DHS and see what some of those resources are available, because they really are excellent. They're very robust. They're things that can help you as an employer, but they're also things that can help the individual as well. Okay. So I know that is a lot of information that I have shared right here. But I want to open it up for some questions and comments at this point. And so I would like to, please share in the chat if there are things that, if you have specific questions, or I'd love to hear from you if there are things that you have been implementing that you have found very helpful, or things that maybe you're struggling with as well, because I really do believe we can learn a lot from each other. So I'm going to open it up for questions, and I also want to be able to open it up to find out if, if you have feedback or things that you want to share with each other.
I don't see any questions coming in yet, Kim, but I have a question for you.
Yeah.
So through all of this, the resources are awesome, and just the overview of everything going on. Do people, or I guess my main concern, I'm not in HR obviously, is do people feel that they don't have the skills, very awkward conversations that could get heated. It's like, what do you do as the employer side, the nonprofit leader, where I'm sitting here going, I don't think I have those skills, to deal with that. Like, what is a resource for that, or how do you tackle that?
Mm-hmm. Absolutely. I do think sometimes people's discomfort can hold us back from wanting to take action or wanting to ask those questions. So I completely understand that, where it's like, I really don't want to get into that with this individual because I don't know, I'm not sure how to handle that based off of, whatever response they may give. If that's the case, then if it's an individual, contributor, I would encourage, and they're worried about a coworker, I would encourage them to talk with their leader or supervisor. And if the supervisor is needing some support, check in with HR as well to say, what's the best way? How do we approach this? We're noticing a change in work performance. We're noticing a change in behavior. How can we best reach out to this individual and have these conversations? And it may start, coming from HR. It may have to, the inroad may be more related to concrete changes like in work performance, to be able to say, hey, we just wanted to check in with you on this. And that may evolve into a greater conversation around how that person is doing and coping. But if they tie it to the work performance, then HR, there's more of a reason why HR would be reaching out or a supervisor would be reaching out, as opposed to kind of just directly checking in on their mental well-being. Mhm. I did see a couple questions come through here about, honor frontline workers and support and respect frontline workers and those who may be working in challenging homework situations. Absolutely, absolutely. I think it's very important to, honor and respect that there are many people who have been dealing with, the crisis side, the frontline side of this from the get-go, and there can be a lot of emotions around that. Many people are, there's a lot of, frontline workers who can be feeling very frustrated about things, and being able to say, giving them that space to say, thank you for the work that you're doing. Honoring and appreciating can go a long way. Like, you know what, you have been there, you have showed up, you have been doing this hard work from the get-go through all of this uncertainty. Thank you. And asking, what support could you use from me? Are there things as your leader, as your organization, what can we do to help support you? But also checking in with people as well. Like saying, the challenging work, working from home situations. Some people were like, woohoo, this is great, I'm thriving at home. And other folks are like, this is chaos. This is more stressful for me than being, at work. And I really think if leaders, managers, supervisors can be checking in with people on a regular basis, just to say, hey, how are you doing? I think my manager, every time, we have regularly scheduled one-on-ones like every other week, and she always starts it off with, how are you doing? Because things can change. Just because I said a couple weeks ago I was doing okay, I'm like, no, I got it, everything's going fine. Something else may have changed. And just her checking in and opening it that way with that question, and allowing me the space and making it feel like a genuinely safe space to be open and honest can be huge. To feel like, you know what, I really am struggling a little bit, and not make it seem like it's a fault or that it's somehow a weakness that maybe people are struggling in different ways, but giving them the space and the safety to be open and honest around whatever it is that they're experiencing. And, potentially, hopefully there's a way to troubleshoot some things around that, to be able to maybe help with that. And if not, sometimes just being compassionate and empathetic and hearing them can be huge, just to know that, okay, they maybe they can't change my situation, this is what it is, but they care enough and they want to help and they want to be able to hear what I have to say. Oh, excellent. Yes, Mental Health America, thank you so much for sharing that. They are phenomenal. They have tons of wonderful resources, so I appreciate you mentioning that as well. It may have been in one of the DHS handouts, but yes, that's an absolutely huge one. Mental Health America with their mental health first aid training. Absolutely. I really encourage all organizations to have some sort of training in mental health awareness. You can even have people come in on suicide prevention. You hope you don't have to use some of these, but you want to feel like you're equipped, that if something does come up, you feel like you know the tools or the resources that you can go to, and you know the steps that you can take. And very often, if you don't feel comfortable asking an individual directly how they're doing, if you can not give up on it, but find somebody else who may be more of an appropriate fit to ask the question or share that, can still be such a wonderful thing to be able to do, just to help support that individual. Absolutely. So thank you for folks who have been sharing things through the chat, questions and resources. That's excellent.
I would say too, Kim, with the training, do you know if mental health training through this organization or any others would be done? Are they flexible? Are they doing it virtual? Is it more important to be personal one-on-one in the office? Do you know how that process works?
I do think many have transitioned to virtual. I am a QPR suicide prevention certified trainer, and typically those are done face-to-face, but QPR had to very quickly pivot and allow their trainers to be able to do these virtually during this time. And so they gave us permission to do them virtually, and they also created some virtual materials emails and electronic versions of handouts and booklets and things like that, because they recognize it's so important that, you know, people get the information. I'm sure some of these, it may be really ideal to be able to do face-to-face, but I think one of the things that we've discovered through the pandemic with so many groups having to go virtual is we can still have very effective communication and interactions in a virtual environment. And so especially a lot of systems still allow for like breakout rooms or things like that, even via Zoom, or you can still, you know, have people engage via the chat feature or Q&A and things. And so I do think most of them have now gone to being able to offer them virtually. It's probably up to kind of the individual or individual organizations on whether or not they're able to offer them face-to-face just yet.
Mhm.
Mm-hmm. Oh, thank you. And somebody mentioned that theirs was virtual through Madison College. Excellent.
One of the other things I'll say that comes up too, that in the midst of all this, we forget is that people can actually just get sick normally, regular
Yeah.
cough, cold kind of thing. And so can their children. So that can be a challenge. So it's a, you know, challenge of the pandemic on top of just the normal catching a cold, maybe an
Yes.
injury. And then what do you see coming now going into fall and winter with the flu, which is the normal flu? I
Right.
mean, have you seen, or are you guys
Yes.
preparing from a mental health perspective for that as well?
Yes, that's a great question, and I'm very curious to kind of see what will happen with that. I mean, last year they saw very low flu numbers because everybody was all masked up, and so it wasn't circulating, and people weren't getting sick as quite often as they were. But I know there are some folks that are posing questions out there, and I'm not the expert to answer it, but I know people are wondering, can I get the flu shot if I've been vaccinated, or if I have COVID? And you know, they're still kind of wondering, what do I do this year for that? Is it safe to be able to do that? And so I think it wouldn't surprise me if there is an increase in some anxiety as we go into the fall and cold and flu season, where people may start getting more sick with other things. And that does make everybody feel more anxious. I mean, you think about if you go out in public, even if you're masked, it's like, please don't let me cough or sneeze or do anything because everybody's going to like scatter, you know, around me in the store, because everybody's really kind of hypersensitive to that because we just don't know. And so I could see some of that, you know, being, you know, a greater concern. And I know a lot of people are, you know, worried about what are we going to see with our young folks in the schools, you know, schools being back in session, and it's still kind of early. We haven't seen huge spikes just yet, but it can happen. And so it'll, you know, I think people are kind of waiting to see what's going to happen with this. But I could see, you know, the summer felt safer. It felt more relaxed. You know, things were, you know, the numbers were lower, especially like June, early July. It felt like, okay, I can actually do something and not have, I can take my precautions, but I don't have to feel on guard the whole time. And I think some people might find getting into this season where people get sick more often with lots of things going around, and you hear about RSV and other things that are floating around, that some of that anxiety and that worry is going to bubble up a bit more again for folks. And that may be, you know, individually where we're thinking about, okay, what do I have control over then? What would help me kind of mitigate some of that stress and anxiety that I'm feeling? What can I do? You know, what precautions do I want to take? You know, I can't control everybody else's actions as much as a lot of us would like to. I can't, but I can choose for myself what is going to help me feel safe, what is going to help me feel, you know, supported and feel good in my, you know, in my situation. What choices am I making if I'm starting to notice myself getting more nervous or more hypersensitive or just more anxious? What do I have control over?
I'll keep asking you questions, but I encourage everyone to also ask questions. And specifically, if there's things you're doing in your office that you can share. I know many things could be confidential, but if you could share, just since everybody can see the comments, that might be some good ideas for other people. One thing too that I focus on, so in my group, we work primarily with nonprofit organizations, and there's the other flip side of it where we try to focus on with our staff saying, don't forget that if you're stressed out, if you're nervous, if you're all these things we've talked about for the last 45, 50 minutes, so are our clients. So, like be kind, be gentle, it goes both
Mhm.
ways. And it's that
Mhm.
outward facing sign too of all these organizations that are working with, their constituents. Who do they serve and how do they deal with that? Because whoever they're serving most likely is in a far worse situation than I know I would be, just from a, just
Mhm.
situation of, what do they do for a living? Are they employed? All those things. And so we always have to keep
Yep.
remembering what's
Mhm.
that empathy for the other person.
Absolutely, absolutely. That is such a great point. And one of the things that I do for my role is I'm one of the health coaches, and we were doing some health coaching, and you would hear just the whole kind of spectrum or gamut of experiences that people have had through this pandemic, where, yes, some folks were like, okay, my significant other lost their job, and now we're worried about financially making ends meet, and very anxious and stressed. And then I'd have folks on the other end of the spectrum where they're like, life is slowed down. I'm working from home. I don't have to commute. I actually have time to work out. I'm thriving. And it's like recognizing that it's such an individual thing, and people are all over the place with their experiences. And so, recognizing that for those folks who are feeling pretty good about things, there's a lot of folks who aren't. And so having that empathy. And, I personally, I said it so many times, my kids were virtual, but they were 11 and 13. I'm like, they were self-sufficient. Had I been dealing with, a 2 and 4-year-old, my mental well-being may have been totally different than it was. And so very aware of that and recognizing that, I think, especially, we as individuals, but also, as leaders in organizations, knowing that, the people that are working with us, and as you were saying, even the people that you're working on behalf of, are coming from very different situations, and to not project our experience onto somebody else, but really find out where they're at and honor where they're at, empathize, be compassionate, because some folks are still really, really struggling. There isn't that end in sight, or they've been frontline this entire time and they are so done, but they continue to get up every day and do what needs to be done, and they keep moving forward. And so just, really being grateful for folks who are in those roles, but also just recognizing, yes, everybody, we're all in different places with this. And just because somebody might be doing okay, somebody else might really be struggling, and checking in with them, not making any assumptions or anything.
And I'll just make one more comment too, as we're wrapping things up. So in our office, just to share, we have been, our Brookfield office is more likely to be in the office. Our Madison office is more likely to be at home. But we've been trying to keep things very equal between the two, really cognizant of people's comfort level of, initially when we thought we could go back to work much sooner, it was like the return to work policies, which then almost immediately the tide has changed. And so just backing off of those things to not create additional anxiety. But a number of things we've done are, during our tax season, we've got little gifts in the mail, we're able to do that, which is great. I think those are just little fun mental health boosters. They just definitely don't want to solve underlying problems or really deep-seated things that are going on. But I think just as an employer, trying to do things to boost morale and to keep people calm. And also the biggest thing too is just to let them know, you feel you can get really isolated and feel that you're not alone, that we're in the same boat together. And so I think that's been helpful for our staff. And then also we did small group meetings real frequently, mixed up people that would never in the office probably wouldn't even meet each other, because we're large enough where that would happen. So I mean, just from some simple things that we've done that I think are more morale, partly mental health, but not necessarily, the big serious issues that we're talking about today. But just wanted to share that as well.
Oh, thank you for sharing that. I love that. Absolutely. Yes. Our employer, my employer, they sent out periodically some little trinkets and things like that early on. And it's just, it's fun to kind of get a little care package in the mail. But one of the things and I know all of our departments and teams here at Quartz have kind of had to handle things differently, but the team that I'm a part of, there's about 10 of us on it, very early on, just for the social connection, started scheduling like Wednesday Tuesday mornings before the regular workday, a Zoom call just for half an hour,
Mhm.
purely to socialize. And it's like, it's a standing one every week. So if you can make it one week, great. If you can't, great. But it's just chit chat. It's literally just to talk about whatever, see somebody's new puppy or whatever, whatever's going on. But it's the kind of stuff that we would probably chit chat for a few minutes around if we stopped by somebody's desk in the office, and we just haven't had that. And so just to be able to keep up those relationships and those connections, I have to say it's probably one of my favorite things. I hate to miss it just because that's my chance to be able to check in, with my coworkers, with my friends, my team, to really just be able to see, how are you doing in life? We talk in meetings all day long, but what's been going on? And I know that, we've tried to find bigger ways to do that. And groups are like, yeah, how can we do like a virtual retreat? Or now, when the weather's nice, more groups are trying to say, can we meet someplace, but meet outside, and feel like we can still actually have that face-to-face connection, but be able to be outside. And I know even some groups have been doing what they call, even if it's virtual, they've been doing like active meetings. They're like, if it's just me and like one other person, let's get out and walk in our own separate locations, but let's do it on the phone. Let's get on our cell phones and get outside and walk and talk about whatever topic we need to, just to feel like we can get some fresh air, change a perspective and location a little bit. So people, I think, and organizations are finding creative ways to still engage with each other, feel like people can be connected, not so isolated, and getting out of your house or getting out of your four walls or your desk in your cube area if you need to.
Yeah, and I do have to say, with the clients I'm working with and just the nonprofits in general, I'm connected to through, say, Facebook or LinkedIn. I'm seeing lots and lots of pictures of get-togethers or staff people together. If it's an event they're doing or whatever they may be doing. I have to say too, when I came home in March of 2020, I was like, what is going to happen to the people I work with? And I have to say, the nonprofit organizations in this area, in Madison, in general, are super resourceful, went right to virtual, whatever they had to do, got really creative with events and other funding sources. I have some clients that did very well in the fact that they were super aggressive. And so there's, some positive sides. You're very resilient and very, what should I say, inventive, and you don't let it get you down. You keep moving forward, which is great. I guess we'll wrap it up, and thank you, Kim. This is really good. Lots of great information. I would encourage everybody to check out Kim's resources that you'll receive. And just want to thank you for being part of this today and offering all your suggestions and acknowledgement of what everybody's going through. And then for all of you on the call, our next event, as I mentioned, is in December, which may be in person, but maybe virtual. Who knows? We'll decide. But when you get the invitation, please remember, you can forward it to anybody in your organization, anyone you're contacted with in the nonprofit sector, really catering to nonprofit organizations, or even those who serve on boards of nonprofits. So you may be obviously working for a private company. Just want to make this available to as many people as possible, and just out here to help and educate. So keep that in mind. And again, Kim, I'll thank you for being here. And for everyone else, hopefully we will see you in December. Thank you so much.